Dr. Jesse Bell, he's a professor at the University of Nebraska Medical Center. His research explores the relationships of climate and extreme weather on natural and human processes. He has quite a resume, and so I can't share everything, and you can see that on the slide above. He's been involved in a lot of things. He's been the author and contributor to many climate and health reports and organizations and efforts all across the nation, not only in the Great Plains in Nebraska, but a big footprint. So we're happy to have him with us today and share with us why climate matters to the health of people in the northern Great Plains. So with that, thanks, Dr. Bell, for joining us, and I'm going to go ahead and turn it over to you.
Thanks, Tyler. I appreciate it. Can you see the screen okay?
Yes, can.
Okay. I'm going to mute myself. There we go. So yeah, I'm going to talk about why climate matters to the health of people in the northern Great Plains. And so just to give you a little bit of an overview of what I'm going to talk about today. First, I'm going to talk about climate and health, how those two things are interconnected, talk about our changing climate and what that actually means for agricultural production, which is important for here in the northern Great Plains, but then also about how our changing climate impacts our health, and then just have some closing thoughts on some of the things that public health departments and that I'm working on moving forward to help this region to deal with some of the issues that climate is going to bring about in the context of human health. Let's see. So first, just to start off with, I just briefly want to touch on the fact that weather and climate is different. I'm sure a lot of the people that are on this webinar realize that, but weather is what you get, climate is what you expect. This was attributed to Mark Twain, but there was other, Mike Heinlein is likely the first person that recorded that. And so just to start off with, I'm going to talk about climate and health in the broadest context. We've understood for a long time that climate has a direct relationship to human health in a variety of different ways. When you go all the way back to Hippocrates in ancient Greece, he was writing about epidemics that were happening in 400 BC and noted that changes in weather and changes in climate cause increases of certain diseases to pop up. And as you know, Hippocrates was one of the founders of today's modern medicine. Then you fast forward to Dr. James Tilton, who is the Surgeon General of the US Army, and he directed all hospital surgeons to keep weather records. And the reason that he did that was he understood, and they understood, that with changes in temperature and changes in precipitation, there was a direct correlation with the health of the soldiers that were out on the ground. And what they understood at that time is that with an increase in temperature and changes in precipitation, they were seeing outbreaks of malaria in soldiers. They didn't understand that mosquitoes were that potential vector carrying the disease, but they understood that there was changes in temperature and changes in precipitation that caused or resulted in the disease occurring. And it's kind of interesting, the foundation of a lot of our current weather and climate records, when you look all the way back to the 1800s, it was because of these early reports that were put out by the Surgeon General, because they took such precise and exact measurements over a long period of time. So this is actually the foundation of a lot of our climate records here in the United States, is based off of some of these Army surgeons. Today, we understand that climate affects our health in a variety of different ways, both directly and indirectly. And I'm going to talk about that in a little bit more in detail as I move forward. But just in brief, direct is the way that it directly affects our health. So extreme heat, air pollution, extreme weather, these are all things that potentially impact or affect our health directly. Indirect is the way that the climate around us changes and then results in potential spreading disease, disrupting of food supplies, water supplies, and disrupting our well-being as well. And again, I'll talk about that a little bit more in depth in a bit. But that just kind of gets to the fact that there's the direct impacts and the indirect impacts. And internationally, we know that climate has a significant effect on human health. Droughts are likely the leading climate or weather-related disaster internationally, where floods are the second leading causes of death internationally over the last century. But But here in the United States, it's actually heat waves are likely the leading cause of death in the US compared to other climate or weather related disasters, followed by tornadoes, hurricanes, and floods. This is data provided by NOAA over a 10-year period from 2004 to 2013. This is part of a report that I was associated with. And also during that same time period, we know that these particular events cost a lot economically in the United States, with billion-dollar disasters over that same time period totaling $400 billion for hurricanes and about $80 billion for heat waves and droughts, and then almost $50 billion for tornadoes and severe storms. So, like I was talking about, there's a lot of potential. So I got to get rid of that. There's a lot of potential impact that this has on human health and on our economy around the United States with extreme weather and climate-related disasters. And I just kind of wanted to illustrate this just to give you a little bit better perspective of those direct impacts versus the indirect effects. And I think the best example is actually Hurricane Maria that happened down in Puerto Rico back in 2017. When that hurricane hit and the devastation was seen across much of Puerto Rico, it cost roughly, based off different estimates, upwards of 64 deaths based off the initial when the hurricane hit the island. But then a year later, the death toll reached upwards of 3,000 plus deaths that were attributed to that hurricane. And that gets back to those indirect versus direct. Direct were the people that died in the flooding, died when the direct storm hit their coasts and caused the damage. The indirect were, over that next year, all the other people that died because of loss of power, loss of electricity, damage to infrastructure, all these other things, the spread of disease that cause people to go to the hospital and potentially die.
Hey,
and
Jesse.
we know about that based off of a few different studies. So here was a report that came from Rappaport and Blanchard in 2016 that looked at all the different ways that humans died due to tropical cyclones, hurricanes in the Atlantic. And as you can see, there's everything from cardiovascular incidents, evacuation, vehicular incidents, power outage problems. These all are other ways that people die when some of these events occur. So like recently in the Northern Great Plains, we experienced major flooding this year. And with that major flooding, the death toll wasn't very high with the people that directly died because of the floods. But you should realize, as we do realize, the potential impacts are much longer lasting. And the number of people that potentially die because of these storms and because of these events can be much greater than what that initial death toll actually is. And so that's something to definitely think about with anytime one of these storms or anytime one of these major events occurs, that it's not just the direct deaths, but it's the indirect deaths that could have significant problems throughout the communities and throughout our states.
Hey, Jesse, this is Tyler. Can you hear me?
Yeah, I can hear you. Can you hear me okay?
So, yeah, I'm going to pop up that poll. I don't want it to cover your screen, so you can just minimize it instead of...
oh, I'm sorry.
That's all right. You can just minimize it so it's not in front of you. I'll get that put up here in a second. So.
Yeah, I was going to say, it just like popped up and I was like,
hit minimize, not X.
Okay.
All right, thanks.
Sorry about that, Tyler.
Yeah, you got it.
And so you might be asking, like, well, why am I talking about hurricanes when I said I was going to be talking about the Northern Great Plains? Well, one of the things we know is anytime one of these extreme weather events or climate-related events occurs, it has a ripple effect across the country. And this is just one example here from FEMA data showing where the displacement of all the different people from Hurricane Maria when it hit Puerto Rico occurred across the United States. And as you can see, there was a number of people after they fled Puerto Rico because of the devastation and destruction that went all across the United States, even up in the Northern Great Plains. So anytime one of these disasters happens, it has the potential of rippling across the entire country. So I'm now going to transition and talk a little bit about how our climate is changing and the potential impacts that it has on health, especially here in the Northern Great Plains region of the United States. Typically, when we think of climate change or we think of a changing climate, we think of it in the context of maybe polar bears or the Arctic or places far away from us. But one of the things that I want to try to do is talk about the fact that this is something that's happening here in the United States. It's happening in our backyards, and it's happening in the states in the northern Great Plains as well. So what do we know? As most of you have probably heard or seen, we know that the temperatures have been changing over the last century, where we've been seeing an increase in temperatures, especially over the last 50 to 60 years. We know that the patterns of change are vary greatly across the United States, with the northern part of the United States seeing some of the higher temperature increases, especially here in the northern Great Plains. We also know that the observed precipitation change, or the precipitation is observed and changed across the United States as well, where we've seen an increase in precipitation, especially here in the northern Great Plains, but in the western part of the United States, we've actually seen a decrease in precipitation. And we also know that future temperatures are going to continue to increase as we move forward, where we project that the future scenarios of changes in greenhouse gas emissions will likely cause will likely cause an increase in temperature across the United States, especially in the northern Great Plains. And then one of the other things that we are, just want to move that pole out of the way. One of the other things that we're experiencing is we'll experience is an increase in or changes in precipitation as we move forward as well. Where in the northern part of the United States, we expect that it will likely get more precipitation during the winter months and potentially less precipitation in the summer months. And not only are the averages over the entire year changing, but also the way that it manifests with individual events. So we expect that the hottest days of the year to get hotter, so more heat waves, and the wettest days of the year getting wetter, more intense precipitation, and the dry spells to be even longer, where we see more potential for drought-like scenarios. And not only that, we've already seen a change in our extreme events across the United States. So like I said, we've seen an increase in temperature. We've seen more extreme heavy downpours of rain. We've seen more flooding, especially in the Midwest and Northeast. Hurricane intensity and frequency has changed, especially the strongest storms. Sea levels have risen. Cold waves have become more intense, similar to what I was saying before, where we're seeing and winter storms have become more intense and more frequent. Our cold waves have been less frequent and intense across the nation, whereas winter storms have increased in frequency and intensity. So going back to what I talked about, where we actually see an increase in precipitation moving forward in the northern Great Plains region. Droughts have increased in the west and in the southwest. Heat waves have become more intense and frequent, especially in the western part of the United States, and wildfire seasons have become longer, and that's partially due to the changes in temperature. So the wildfire season is actually starting earlier and lasting a little bit longer as well. And so we know that this has a variety of different ways that it impacts our farming communities and farming just in itself. Temperatures and precipitation extremes like flooding can lead to pathogen loading, which then can alter the amount of chemicals, agrochemicals that we put on our crops. Rising CO2 concentrations have a direct relationship with nutrient content in food, where we actually see a decrease in nutrient content in some foods associated with increases in CO2. Warmer temperatures can result in greater food spoilage, and extreme events can lead to difficulty in distributing foods to houses or across our country. But we also know that climate change has a direct impact on human health in a variety of different ways. In 2016, I was one of the lead authors on the report that came out of the White House, The Impacts of Climate Change on Human Health in the United States, a Scientific Assessment. I was one of the lead authors on the extremes chapter of the report, trying to understand the ways that extreme weather events impact human health in a variety of different ways. This report brought together a variety of different experts from throughout the federal government, academia, and the private sector to try to understand what are the potential health impacts associated with climate and climate change. And there were a variety of different findings that came from this report, but two of the first findings that came from the report were that climate change is a significant threat to the health of the American people, and that every American is vulnerable to the health impacts associated with climate change. And the reason that we can say that is going back to what I was talking about before. We've already seen that the climate throughout the United States is changing. And we know that the climate will continue to change throughout the US. And with these changes, there's a variety of different ways that that is tied to our health. And I'll talk about that here in just a second. And there's really no place in the United States that isn't experiencing some kind of change. So that's the reason that all populations are vulnerable and that everybody in the United States is a potential threat or potentially threatened by the changes in our climate. So this is just a graphic that came from my former office at the Centers for Disease Control and Prevention that was trying to illustrate all the different ways that climate potentially impacts human health. And so what you see here is that first inner spinning wheel showing all the ways that the climate is changing: rising temperature, more extreme weather events, rising sea levels, changes in CO2. All of these things, these four things, influence our environment in some way. And that's what that second wheel represents: environmental exposures that potentially lead to human health outcomes. So the second wheel is extreme heat events, severe weather, changes in vector ecology, air pollution, allergens, water quality impacts, water and food supply issues, and environmental degradation. Those changes in our climate impact that second wheel. And then that second wheel is how we get to human health outcomes. And as you can see here, and I'll talk about some of these in a little bit more detail in a second, but you can see the variety of different ways that human health is potentially influenced by climate and changing climate. And so this is just another way of looking at how we get from a climate driver down to a human health outcome. And so this pathway kind of looks at that previous spinny wheel to try to show how climate influences human health. So the first part, the climate driver, that's the wheel that was spinning. That's the inner wheel. Increases in temperature, extreme precipitation, sea level rise, all those things. Then that leads to the exposure pathway. That was the second wheel in that previous diagram. So extreme heat, poor air quality, reduced food, infectious disease agents, population displacement. That's how you get to your human health outcome. And so that is just a linear way of looking at that previous diagram. Now, one of the things that you'll notice here with this one, and one of the reasons I put this up, is you have the gray boxes on the outside. You have the environmental and institutional context, and you have the social and behavioral context. That's what your community looks like. That's what the environment around you looks like. And that's how we either see an increase in human health outcomes when we see a climate event, or we see a potential decrease in human health outcomes associated with these climate events. And so social and behavioral context, like I said, that's what your community looks like. That's what the area around you looks like. That's what people that are living in those communities looks like. So age, gender, race, ethnicity, poverty, infrastructure, education levels, discrimination, access to healthcare, pre-existing health conditions in the population. Those are potential issues that could exacerbate or increase the number of health effects that come about whenever a climatic event occurs. And then the environmental and institutional context is land use change, ecosystem change, infrastructure. That's what your ecosystem looks like. That's what the environment around you looks like. And again, those are potential factors that can lead to increases or decreases in human health outcomes. These gray boxes are also things that we could potentially influence in some way if we understand what our communities look like and we understand what our populations look like, so that we could put practices in place to reduce human health outcomes the next time major events occur. And as I said, all populations are potentially vulnerable to the impacts of climate and climate change here in the United States, but certain populations are more vulnerable than others. And this is typically older adults, low-income communities, children, and communities of color. A lot of times these are due to Some of these communities having access to less resources to be able to deal with some of the issues associated with our changing climate. And sometimes it's pre-existing health conditions or a variety of other issues that potentially could occur because of climate-related events. So now I'm going to go into a little bit deeper dive here and talk about the health issues associated with our changing climate. So one of the things that we know, especially here in the central part of the United States, is that we've been seeing an increase in extreme heat events, especially over the last 50 years. With increased temperature, higher humidity, and longer and more frequent heat waves. These have direct impacts on human health in a variety of different ways, including heat stroke, dehydration, and heat-related illness. And as I was saying before, heat waves are likely the leading killer related to climate and extreme weather events here in the United States. And one of the reasons for that is that every place experiences heat waves. Whether it's in Omaha, Nebraska, where I'm at today, Fargo, North Dakota, Minneapolis, Minnesota, Seattle, Phoenix, New York, you name it, they'll probably experience multiple heat waves over this next year. Whereas with some of these other extreme events, they might only occur regionally, or they might occur maybe once or twice a year. But heat waves, you'll see repeated heat waves throughout the year. And so it's kind of the forgotten killer here in the United States. And because of that, there's a potential for a human health outcome anytime one of these events occurs. And the vulnerable populations associated with our outdoor workers, student athletes, people in cities, people without air conditioning, people with chronic illnesses, pregnant women, older adults, and younger children. We also know that air quality is directly tied to our climate, with increases in wildfires, smog, pollen, and mold. These are all things that are tied to a changing climate, and I'll talk about that just in a second. Anybody that has asthma, respiratory issues, or allergy issues could potentially experience these or be susceptible to these conditions. And the vulnerable populations are typically people with heart and respiratory conditions, asthma, and chronic lung disease. And why is this important, especially here in the Northern Great Plains region? Well, we've been actually seeing an increase in our ragweed pollen season over the last 20 to 30 years. Here in Omaha, where I'm at, we've seen around 11 days increase in the ragweed pollen season. But when you go further north, the increase has been even greater, upwards of in Minnesota and North Dakota up around 20 to 25 days increase. And as you know, or as you may know, ragweed pollen is one of the more allergenic pollens out there. And if you have allergies, you know, this is a nuisance. But if you have a child with asthma, these extra 11 to 20 days can be potentially life-threatening. So it's just something to be aware of as we move forward. And why does that matter? Well, for example, here in Nebraska, we have one of the highest death rates associated with asthma in the United States. And so anytime that you're seeing more exposure to things like ragweed pollen, that means more potential for asthma-related issues, which then also could potentially lead to asthma-related deaths. And then extreme weather, as I was talking about, we've been seeing changes in heavy downpours, floods, droughts, and other major storms. Pretty much anybody that's in the pathway of these storms could potentially be affected in some way. And one of the things that we're seeing is back-to-back storms where that have major impacts on communities. So in 2011 in Northern Great Plains, we saw a major flooding. And then in 2012, the next year, we saw a major drought. And so those impacts, like I was saying, are becoming more frequent and more intense. So the potential for them affecting our communities are increasing as well. And that's kind of what we're seeing across the United States. So we've seen an increase in billion-dollar disasters across the US. And so billion-dollar disaster is calculated by NOAA out of my former office in Asheville, North Carolina. And a billion-dollar disaster is basically any disaster that exceeds $1 billion of economic loss. And over the last 30 to 40 years, we've seen an increase throughout the United States. That's partially due to things becoming more expensive, populations growing, people moving to areas that are more prone for some of these disasters, but it's also partially because we're seeing an increase in the frequency and intensity of these extreme weather events as well. And in 2017, we saw this all come to head, where there was $16 billion weather and climate-related disasters across the United States that totaled $306 billion of economic loss and at least 3,000 plus deaths associated with each of these disasters. Many of those coming again from Hurricane Maria that happened down in Puerto Rico. But here in the Plains region, especially Nebraska and Iowa, we're definitely aware of the potential impacts that extreme weather events have on human health and to our communities as well. The recent flooding that happened here in Nebraska and Iowa and throughout the Northern Plains. But in Nebraska, this was the 14th flood-driven disaster to strike in the last 10 years. So we've had 14 major flood-driven disasters in the last 10 years, and this is tied for 5th for most flood-related presidential disaster declarations, according to the Pew Institute, and they got their information from FEMA. So a lot of times when we think of flood-related issues, we think of coastal regions, but one of the things that should be more apparent here based off this figure is that it's the central part of the United States that's definitely being hit by a lot of these flood-related disasters. And again, these have ripple effects across communities. And some of the communities here in Nebraska and Iowa and other parts of this part of the country are still facing the floods and still dealing with it. And so you can see everything from mental health outcomes associated with this to the devastation and destruction that happens within these communities. Throughout Nebraska, there was reports that emergency room visits increased during the floods, and that also some of the call centers for behavioral health issues, there was a spike in number of calls that were associated with those as well. So that just kind of illustrates, again, going back to the direct deaths and direct attribution of the impacts of some of these disasters. That doesn't actually capture the full breadth of potential health effects that are associated with it. And sometimes when you look at just the deaths, and especially the direct deaths, you can underestimate the potential impact that this has on some of these communities. And then the spreading of disease, insects, ticks, and rodents. Higher temperatures, changes in rainfall patterns, and disruption of ecosystems influences a lot of these vectors that potentially carry these diseases like Lyme disease and West Nile disease. And populations that are vulnerable, or anybody that gets out there and outdoors and is potentially influenced in some way by it. And we've known about this connection again all the way back to the 1800s with the Surgeon General, the Army Surgeon General, issuing weather and temperature records because of the relationship that this has with human health outcomes. So we've understood this for hundreds of years, that changes in temperature and changes in precipitation have a direct impact on things like mosquitoes and the spread of disease. Moving forward, we expect that Lyme disease will start coming out earlier with our changing climate, and we'll be seeing earlier arrival of some of these ticks. So that means when they come out earlier, that means it's a longer opportunity for you to be exposed to the ticks that carry Lyme disease, so potential increase in exposure. And that's partially kind of what we're already seeing. So this is the spread of Lyme disease from 1996 to 2016. So this is a reported number of cases from CDC of Lyme disease in 1996. And this is 2016. I'll just flip back and forth a little bit here to show that spread of the disease. And as you can see, in 2016, we've seen a dramatic increase in the number of Lyme disease cases across the United States, especially in the northeastern region of the US. One of the other things, especially here in the northern Great Plains region, we've been seeing a pretty sharp increase in Lyme disease, especially throughout Minnesota and heading over towards South Dakota and North Dakota. And this is partially due to just the natural spread of the disease, but also because of changes in the temperature and precipitation patterns across that northern plains region, or the northeastern region of the United States. And I heard that there was some interest in West Nile virus and the potential influences that climate has on that. We know that the highest abundance of cases, incidence of cases, is in the plains region of the United States. And we know that this is a fairly new disease. The occurrence of this disease is fairly new. Some of the first reported cases were back in 1999, but moving forward in the United States, 2002 was basically the year when everybody got it. And it was like the disease just rapidly spread across much of the United States, especially that central part of the US and the plains region. And what we saw was a decrease in the number of cases a few years following, and then a basic sustained level of incidence over the last 10 plus years. We also know, going all the way back, like I said, to the 1800s, that there's a direct relationship between temperature and the incidence of West Nile. And so as the temperatures increase, we typically see an increase in the abundance of the mosquito. And that happens throughout the year until about September. And then from September moving forward, we see a decrease in the number of cases or number of incidents of West Nile. And incidence per population through the different age demographics, one of the things that we see is higher abundance or higher incidence in the older age categories of people exposed to West Nile. And the association with drought and West Nile and flooding, with potentially what's going on this year, is kind of a tricky one. So in 2011, in the northern Great Plains, we knew that there was major flooding that occurred, and that was one of the lowest cases of West Nile occurrence. And then in 2012, we had a major drought that hit much of the United States, and we saw one of the highest abundance of cases associated with West Nile. So it's not always more water equals more mosquitoes, but it can. And so it's a difficult relationship, but it doesn't necessarily mean that it's a one-for-one type of a scenario. So like in the 2012 drought, you can see more pooling of water. You can also see changes in management practices of water, which means maybe keeping more potable water near your house, more stagnant, stale water sitting next to your house for gardening or different purposes, which is a perfect breeding ground for mosquitoes. And that perfect breeding ground for mosquitoes means that it's a direct relation or a direct impact that and spread of that disease. And so the best thing is, no matter what, we've always had some, over the last 10 to 20 years, we've seen some occurrence of West Nile throughout the northern Great Plains. And so it's best just to control for the mosquitoes and try to make sure you minimize the exposure that you have to them. So removing all standing water around your house. This means tires, pots, whatever it may be. Using insect repellent when you go out so that you stop the potential contact with the mosquito. Killing mosquitoes around your home with using insecticides, especially in areas that are more prone to where mosquitoes could potentially be. They like dark, damp places, underside of leaves, places like that. And then just keeping them out of your house. So if you leave your windows open, make sure to keep screens up. Don't keep your doors open for very long, because you want to reduce and minimize the potential exposure that you have to any mosquito. And spreading of disease also is associated with contaminated food and water, higher temperatures, heavier downpours, more humidity and extreme weather events all potentially can lead to gastrointestinal illnesses, especially toxins in swimming areas like harmful algal blooms, which we see in the Central Plains region as well. Vulnerable populations are children and elderly people, but it's pretty much anybody that could potentially come in contact with these these toxins. And then one of the things that I think a lot of people forget about are the mental health problems that are associated with these extreme events. Like I talked about before with the flooding that occurred in Nebraska, they saw an increase in calls to some of the family helplines across the state. And a lot of times that's associated with potential mental and behavioral health issues because of stress, depression, anxiety, PTSD associated with some of the large long-term impacts that happen because of some of these disasters. And this can basically affect anybody at any population or age. And so this is definitely something to consider as we move forward. And it's something I've definitely been interested in. I've done some research on, especially looking at the impacts of drought on mental health outcomes. We know that agricultural workers have one of the highest suicide rates of all occupations. And I think these, I could show you figures and information, but I think some of these stories just are a little bit more telling than anything. There's one where the story that came out of Kansas where I was talking to a farmer about the suicide rates in agricultural workers, and he said nothing gets a farmer down more than drought. And then you got examples from Australia where they've seen multiple year significant droughts there, and they've seen sharp increases in suicides in Australian agricultural communities. And that's just one story that's right there. Hunger and malnutrition, we typically don't have as big of an issue here in the United States associated with some of these extreme weather events and the potential it has on human health. This is typically something that's a little bit more international, but we still do face some of these issues here in the US as well. And then displacement and conflict. With any time a climatic event happens, you have the potential of displacing a population and having them move to another region, similar to what we saw with Maria, or in the 1930s, what we were seeing with the Dust Bowl that happened across the United States, or the central part of the United States. And I always throw this example up here, even though it's not local, I think it's pretty significant, and it really ties it back to the importance of climate on conflict. So the Syrian conflict that happened, or is still ongoing, estimated that it killed over 400,000 people, and there's over 5.5 million refugees that have fled Syria. And likely one of the factors that triggered or helped trigger this event was a significant drought that happened in the Middle East region, multiple year drought. I always like to say, this isn't the only cause of the atrocities that happen in Syria. A lot of the issues that happen in Syria are because of governmental responses and political situations that have been boiling over for a number of years. But some of the factors that are underlying were influenced in some way by a significant drought, or people believe was influenced by a significant drought that occurred in that area. And just to kind of give you the abridged version of what potentially occurred, so you have a multiple year drought. It's negatively affecting the agricultural and rural communities. You have large populations, you have populations of people that can't sustain. They move to urban areas trying to look for work, trying to look for assistance. They can't find that assistance. They become disenfranchised. They start to protest. Protests are met with violent opposition. And the next thing you know, you have a major conflict at hand. And so this is just one example, but you can find multiple examples throughout history where there's a potential for a climate factor that influenced a major conflict that followed. And again, the reason I bring that up is because the issues that happen in Syria have the potential to have ripple effects across the entire globe. And so you have mass migrations of people out of those regions, which means that you have people looking for home, looking for support, and looking for other places to live. So at this point, I always feel like I'm the grim reaper of climate. And I feel like I've made everything just kind of depressing and feel like there's no hope for the future. But that's not my point. My point is to really try to show that there is a strong connection between climate and our health in a variety of different ways. And the next part is saying that there is a lot of hope and there's a lot of opportunity moving forward to try to address some of these issues. First off, just to reiterate the point, climate and our changing climate is a local factor and it has a local impact on our health. And that's one of the things that we can be doing is better preparing our public health agencies, our healthcare facilities and our emergency preparedness folks for some of the impacts that climate has on human health here locally. And that can be done by educating public health about what are the potential influences that climate and climate change has on their local populations, creating early warning systems to help people influence and prepare for climate events, researching some of these connections so that we can better understand what are the health issues associated with climate, so that we can give that information back to the public health officials, back to the healthcare facilities, and back to the emergency preparedness folks so that they can use that information and better prepare their communities. And then inform stakeholders and create a public dialogue to talk about the potential health impacts associated with climate, so that people understand that this is a local issue and that we can do things about it and address these problems locally. And climate and the impacts of climate is definitely something that we're working on, and is a big area where I'm focused on. And that's especially looking at drought. Just recently, I hosted the National Drought and Public Health Summit in Atlanta, Georgia. We brought together partners from the Centers for Disease Control and Prevention, NOAA, EPA, the Natural Resource Defense Council, and a variety of other institutions as well, to try and understand the impacts of drought on human health. Like I was saying before, drought is one of the leading causes of death internationally associated with climate or weather-related events. But here in the United States, we typically don't think of drought as a human health issue. But drought, similar to climate change, influences so many other things. It can increase extreme heat events, it can change air quality, it can change water quality and availability, and all of these things have a potential influence on human health. And so that was one of the reasons that we put together this summit. We're going to have multiple other regional workshops moving forward to try to understand the impacts of drought on human health, so that we can better educate and inform people on these relationships moving forward. And so with that, I really appreciate you guys listening to my talk. Just some closing thoughts here. Climate change is a significant threat to our health. All populations are vulnerable, but certain populations are more. The costs associated with these events, these climate-related events, are increasing. There's multiple relationships between climate and health, and there's a lot that we need to understand moving forward. And by combining expertise and combining different groups, we'll be able to understand and address some of these issues. And we need to address them now, because as our climate continues to change moving forward, the potential health effects are only going to be greater. So need to address it now. So if you haven't had a chance, please feel free to take a look at the climate and health document that came out in 2016. It was a pretty big effort, and it has a lot of good information in it. And I appreciate your time. And if you have any questions, I'd be happy to hear them.
Okay, thanks, Jesse. Yeah, if you have questions, pop them into the chat box. I don't see anything waiting right now, but I am going to try to launch this poll again. And sorry, this poll has been giving me fits all day, so I don't know what's going on. But anyway, so hopefully you're seeing that. You can fill that poll out. If you have any questions, go ahead and type that in. I've got one that I thought of when you're going through, and you mentioned mosquitoes, and that's a lot that we've been hearing. In Nebraska anyway, and probably lots of places that are flooding right now. You know, what other health impacts do you maybe see coming that we haven't realized yet from all of the flooding and excess moisture we've had in the Midwest and plains this spring? Is there anything that maybe people aren't thinking about, or maybe they are thinking about, that you want to highlight or emphasize that you didn't do so on here?
Yeah, I think, you know, initially when we were talking about the flooding, we were worried about the flood-related deaths, the drownings that could potentially occur. But one of the things that needs to be put forth is the potential impacts it has on these communities long-term. One, mold. As people move back into these homes, the potential for mold and mold spores, which can lead to asthma and other respiratory issues, is definitely something that people need to pay attention to moving forward, and making sure that the right remediation efforts are taking place when they come back into the homes to remove any damaged property that was associated with that flooding. And then the other thing is the mental health effects. These things can take months, years to fully manifest. And so, but it has a significant impact on the communities that we're dealing with. You look out through Nebraska or through the central part of the United States with these floods, you hear stories about farmers losing livestock, not being able to plant, communities trying to recover from these events. And that has the potential for leading to mental health outcomes. And when those types of events, when those types of issues do arise, sometimes rural communities don't have some of the resources that are available to help deal with those issues. And so it's definitely making sure that people out there understand that there are resources available in dealing with these issues, and that they can access those if they are feeling stressed, depressed, or just feeling overwhelmed by some of the issues that they're facing dealing to some of these major flooding events. So I think those are two of the major things moving forward, but there's a lot of potential health effects that are going to be associated with this.
Okay, thanks for sharing that. Someone asked if you could show the early and late Lyme disease maps that you popped up earlier.
Sure, if I can figure it out.
Didn't necessarily have a question along with that, but I think it's certainly interesting to see how that really spreads out from 10 years, 20 years. Sorry, my math is wrong. I went to a small school. Yeah.
College, it's not always necessary. Yeah, and so one of the things that you can see here is just where you see the spread of the disease. Throughout the New England area, you see a pretty dramatic increase, but not only that, you look through Wisconsin and Minnesota, you see a pretty sharp increase as well. And as that line starts to move further west, you're starting to see places like North Dakota and South Dakota increase in the number of incidents that they have locally. In Nebraska, here around Omaha, we've been seeing an increase in the number of incidents as well. But some people believe that that's actually because of people going to places like Minnesota or some of the places where you have higher abundance of these ticks, and then coming back and having the disease and not knowing it, and then going and getting it reported. But it could also be, some people believe that it is locally derived as well. So still a lot to be learned about that.
Okay, got a question here. Are there any print materials to help emergency responders be better prepared for the next disaster?
That is a great question. I know CDC, ASPR, and some of those other agencies do have print materials out there for dealing with disasters and disaster recovery as well. If you'd like, you can reach out to me and I can put you in contact with the center here at the University of Nebraska Medical Center, the Center for Preparedness Education. I'm sure that they could provide some of those print materials for distribution.
Okay, and then regards to your Lyme disease maps, can you say where those maps came from? Lisa would like to include them in their own PowerPoint.
Sure.
So
they're from
another one responding similar to that is if you know any specialists dealing with Lyme disease.
Sure. These maps came from the Centers for Disease Control and Prevention. They're available online. You can literally do a Google search of Lyme disease and CDC, and it should take you, I think, directly. It should be one of the first links to find these maps. If you have any issues, I'd be happy to contact me, and then I can try to forward you that information. And then experts that are working on this, especially related to Lyme disease and the relationship of climate. There's researchers from the Centers for Disease Control and Prevention that are working on this. It's the main researcher that's working on it, and his group is Ben Beard. And so CDC has some folks that are directly associated with this, but within each state, you likely have an epidemiologist that's focused on some of these infectious diseases. And so they would also be a potential local source for information as well.
Okay, thanks. I got one more here for sure. Do you have any tips on states who are revising drought plans and what we can do to incorporate a proactive or mitigation approach to these issues?
Well, I think that's a great point. And I think that's one of the things I'm interested in trying to get better connected to. And one of the things that I'm hoping we can figure out as we move forward as well. So when I was at CDC, we were looking through a lot of the state drought plans and emergency preparedness plans to try to understand, are they incorporating, if they are incorporating drought, are they incorporating human health into that into some capacity? And the results were mixed at best. It seemed like a lot of places weren't really thinking of drought and human health in the same context. Here in the United States, I think we typically think of it as an agricultural issue or even a water supply issue, but not necessarily a health issue. And so how could you better link in some of those drought mitigation plans with public health? It's inviting public health officials to the table and having them be a part of this discussion in some capacity. I think that's the first step moving forward, is making sure that, one, they understand that there are potential health effects associated with drought, but also having them part of that conversation so that they can interject that in some capacity. So it's not just about agriculture, it's not just about water supply, but trying to get as many people at the table so you can talk about it in the context of public health and human health outcomes. I think that's a good starting point.
Okay, got another question. This one's from Emily, and it's something that we all tend to deal with. But she says she works in outreach and often runs into a wall in her community where climate is overly politicized and thus talking about it is avoided. She asks, how have you framed the conversation to make people aware of how the direct human health effects of climate change impact everyone without alienating your audience?
That's a great question. That's a $1 million question as well. So I don't know if I have the best answer for it, but I've got my answer to it. And that one of those things is just trying to, I don't talk about it in a political context in any way. On both sides of the political aisle, you see people that are interested in trying to address climate change. I also talk about it in the context of locally. Like I said earlier in the presentation, I think a lot of times we get hung up on things like, this is changing the Arctic or this is changing Africa or something like that, but really trying to illustrate that a lot of these connections are here in our backyard. And those health effects especially, and health I think is one of the best ways of kind of framing that, because it does have so many influences on human health. And if we're not talking about that, and that's not part of the conversation, then we're really missing what is important to us and important to our communities. So I really try to frame it in that context. I also talk about it in the context, like I did today, where, let's say you don't believe that there's a human-caused reason for climate change. We know historically that our climate has changed. We can measure that. So just focusing on that alone, we know that our climate is changing. We know that that has a potential for human health outcomes. So why not get our communities prepared for the next time we face one of these major events? And that's kind of how I've been trying to frame it, because my interest is definitely the preparedness side. How do we prepare communities? How do we prepare public health officials, emergency preparedness officials, healthcare facilities to deal with these events? And that's where I'm just trying to build the conversation. So that's kind of how I've framed it recently.
Okay. Yeah, and the only thing I'd add is I get into this a lot, and I found out a lot of times the messenger makes a big deal. It's a big deal on how well it's received. So Emily, you might just be the right messenger too, that maybe in a non-biased place where they trust you. So that's a lot of times that's half the battle. And so thanks for the comments, Jesse. Yeah, so that is the last question that I have showing on the Q&A or in the chat box. So I think we got them all covered. Don't see anything else. So if you forgot Jesse's contact information, again, this recording will be up on northcentralclimate.org, and you can rewatch it as many times as you'd like, or call Jesse and get the in-person version. So anyway, so with that, I'll go ahead and end the recording.